If you like psychology content, subscribe to Psychology in Minutes for more. Have you ever met someone who could explain incredibly complex ideas, solve practical problems in seconds, or create amazing artwork, but struggled to read aloud, spell simple words, or do basic arithmetic? It can seem confusing at first. How can someone be so intelligent in one area and yet face significant challenges in another? Maybe you've experienced this yourself. Perhaps school always felt harder than it seemed for everyone else, even though you knew you were trying just as hard. You studied longer, focused harder, and still felt like your brain wasn't cooperating. Today, we're diving deep into learning disabilities, what they are, why they happen, how they affect our daily life. And one of the biggest questions people ask, can someone with a learning disability still be highly intelligent? The answer might surprise you. A learning disability is a neurodevelopmental disorder that affects how the brain receives, processes, stores, or responds to information. It doesn't mean someone isn't smart. In fact, many people with learning disabilities have average or above average intelligence. Their brains simply process information differently. Think of it like two computers running different operating systems. Both are powerful, but they process commands in unique ways. Learning disabilities usually become noticeable in childhood, especially when academic demands increase. However, many people aren't diagnosed until adulthood. The most common types include dyslexia, dyscalculia, dysgraphia, and nonverbal learning disorder. Dyslexia primarily affects reading and language processing. Someone with dyslexia may read very slowly, skip words, reverse letters, struggle with spelling, or have difficulty sounding out unfamiliar words. Reading can feel exhausting, almost like decoding a secret language every single time. Dyscalculia affects mathematical abilities. Individuals may struggle to understand number relationships, remember math facts, estimate quantities, tell time, or manage money. Even simple calculations can feel overwhelming. Dysgraphia impacts writing skills. Handwriting may be messy or inconsistent. Organizing thoughts onto paper can be incredibly difficult, even when the person knows exactly what they want to say. Nonverbal learning disorder often affects spatial reasoning, social understanding, and interpreting nonverbal cues. Someone may excel verbally but struggle with maps, body language, or understanding social nuances. Symptoms can vary widely, but common signs include difficulty reading, writing, or solving math problems despite adequate instruction, taking much longer than peers to complete assignments, frequently mixing up letters, numbers, or sequences, poor memory for instructions, avoiding schoolwork due to frustration, low self-esteem caused by repeated academic struggles. Emotionally, these challenges can be devastating. Many children with undiagnosed learning disabilities begin to believe they are lazy or unintelligent. They're neither. Research suggests genetics play a significant role. Brain imaging studies have shown differences in neural pathways involved in language, memory, and processing speed. Environmental factors can also contribute, but poor parenting does not cause learning disabilities. Now for the burning question, can people with learning disabilities be gifted? Absolutely. Many successful entrepreneurs, inventors, actors, and scientists have learning disabilities. Some even believe their different way of thinking contributed to their success. Their brains often excel in creativity, innovation, problem-solving, and big-picture thinking. Treatment focuses on support, not cure. Educational interventions are highly effective, especially when started early. This may include individualized education plans, specialized teaching methods, and classroom accommodations like extra time on tests. Assistive technology can also help. Text-to-speech software, audiobooks, speech recognition, and organizational apps can be life-changing. For adults, coaching and workplace accommodations can dramatically improve functioning. Equally important is emotional support. Therapy can help address anxiety, low self-esteem, and academic trauma. A certified clinical psychologist can provide assessment and therapeutic support. Educational specialists can teach practical strategies. Learning disabilities do not limit intelligence, creativity, or potential. They simply require a different path. And sometimes different paths lead to extraordinary places.